Good morning, everyone. We're still in the morning, 11 a.m. Are you excited for the lecture? Yeah. Okay. Have you heard about health literacy? Before
Yes.
I lecture, she already presented the same article I published in 2015 in Research and Administrative Journal. What's the difference between the health literacy and the regular literacy? We know the literacy, we know the regular literacy. We care about the health literacy here. So the difference between the literacy and the health literacy. Literacy is talking about any reading and writing, which is the general one. Okay, if you read news, if you read an article in a journal, magazine, if you write something, so your ability to read and write and compute numbers. This is the general literacy. But as healthcare providers, we care about the health literacy. Means I care about writing, reading, and understanding of health-related materials. I need to know how to read the health-related materials and to understand these writing. For example, in the US, they don't have the OTC medications in the pharmacy itself. They have it on the shelf. So any customer, they can go and grab an OTC medication without asking the pharmacist, because those OTC medications, they are available on the shelves outside the pharmacy. There is no gatekeeper, no one can prevent you from taking any of those OTC medications, cough preparations, skin-related medications, and cold preparations. So, how can I define the health literacy in case? In this case, health literacy is you go to the, for example, a coffee preparation, and you need to read by yourself the content, the indication, the dosage. After you read, you need to understand how to use it by yourself without the help of others. If you need to help from others, that means you have limited health literacy. So good health literacy, you mean you need to read the instructions, the leaflet, the content, and you need to understand and you need to work on those instructions. Not only understand, but to follow the instructions. If they say 5 ml every 6 hours, 5 ml 3 times a day, after meal, this causes drowsiness. You need to read and understand and follow these instructions. Otherwise, you cannot compare health literacy with literacy, because, for example, the simple literacy means you can read it, but you don't understand. What do you mean by 5 ml 3 times a day? When I should take this? Why I should take it after meal? You need to understand and you need to follow the instructions. That's why we care about the health literacy. If we don't have good health literacy, if we have limited health literacy, what do you think the consequences? If a patient has limited health literacy, what do you think could you give me an example about the limitation or the consequences?
The consequences maybe increase the medication errors or the adverse reactions.
Exactly. One of them will be medication error. Which medication error? As you know, if you remember the lecture about medication safety, in the community pharmacy, who is in the community, who is responsible for medication administration?
Caregiver.
Patient and caregiver. What do you mean? Like if we have an old lady in the home, who will give this medication to this old lady? Usually the caregiver or the lady herself. So if this lady or the caregiver has limited health literacy, cannot understand every 8 hours, cannot understand after meal, we will have administration error, which means medication error. So exactly, we will have medication error. We will have low medication adherence. What do you mean by medication adherence? If this person cannot understand this medication is important and you cannot stop scheduled medication. For example, if this patient has diabetes, and this patient cannot understand diabetes is an incurable disease, and he must take medication every day. If they don't have this knowledge, they have limited health literacy about the diabetes, will end up with what? When the patient feels good in the morning, he says, I'm good today, I don't want to take my medications. Because he doesn't understand this disease is incurable, and this medication, scheduled medications, must be taken every single day. So this is the health literacy, الثقافة الصحية. It's related to the material, related to the understanding. If we have low health, low medication adherence, if we have medication errors, we will have more frequent adverse drug reactions or events. We'll end up with what? With an increased hospitalizations. And because we will have poor health prognosis. So the idea is not to, because the idea, the health literacy is not related to the patient himself only. The health literacy will affect all the system. Because if this patient has limited health literacy, he cannot understand what the physician is saying, cannot understand what the pharmacist is saying. That's why in the US they don't rely on because in Iraq we have the marker, we put on the sheet 3 times a day. We don't usually give full instructions, which is not good way, because if we need this patient to have good adherence, we need to give full instructions. That's why they give it vial. The vial has the all information, because if they go to the home and they forget what the pharmacist say, they can't find the instruction on the vial. But in our case, if they go to the home and they find 2 lines only, they're gonna, when this will be, is it every 12 hours? Is it after meal? Is it before meal? Is it, there is no like details on this. So keep in mind, health literacy is very critical, it's very important, because it's related to the adherence, related to adverse drug reaction, related to medication errors, related to the frequency of hospitalization. So this is the big difference between literacy and health literacy. Imagine, even in the US in 2003, they have 80 million Americans, which is 36% at that time. They have limited health literacy. Why? Because health literacy needs education level at 7th or 8th grade. 7th or 8th grade mean either first year or second year of the middle school. يعني أول ثاني متوسط. Imagine. But the average population education less than that. The written material and the medications, or for the health related material, they usually need 1 in the middle school to understand this. But not all people, they have middle school education, imagine. So they have 99% of Americans, they can read, but only 12% of them, they have good health literacy. Because the health literacy is not the same as literacy. They can read, but they cannot understand the instructions. They don't understand how they can use the insulin. They can read it, but they cannot understand how to use it. Or how can they treat their hypoglycemic signs and symptoms. So keep in mind, health literacy is essential for the, if they don't have good health literacy, they will not have good ability to make good decision. For example, if they need to choose between surgery and non-surgery, if they don't have enough background or enough information about the surgery, they cannot decide. They may decide not to do it, while it's good for them. So it's good for, I need my patient to have good health literacy, because I need them to respond to my instruction, I need them to take their medications, I need them to make good decisions. All this will influence our healthcare process. Because if we have low health literacy, we will have high costs. We'll have poor prognosis, as I mentioned. So consequences of low health literacy will increase the. Why do you think low health literacy will increase emergency room admission? Why do you think this? What's the relationship between low health literacy and an increase in medication error, an increase in adverse drug events? And for example, if my physician say you need to take insulin three times before meals, 40 units before each meal. If I don't follow those instructions, I have limited health literacy. If I take it before meal and I don't eat after it, I will have hypoglycemia. Hypoglycemia may cause admission to emergency. So health literacy, I need to know when I take the insulin, I must eat after the dose, because otherwise I will end up with hypoglycemia. Imagine, those are health literacy. You need to know how to deal with your disease, with your medications, when you must take it, when you must stop taking. An increased hospital stay, saying treatment plans. What the advantage if you have good plan, the physician did very well job in diagnosis and the pharmacist dispensed the right medications. As a patient, we don't take it. If the patient doesn't take the medications, all the medication process will fail, because there's no advantage, because we have the right medication but we are not taking it. So there is no advantage of this medication. This is the health literacy. Mortality rate increase. So imagine the US, 2003, they have only 12% they have proficient health literacy. Imagine they have 13% of people they have below basic health literacy, and 22 of them they have basic. Actually, we don't have such census in Iraq because we don't have comprehensive studies or with participants. One of my study, I was planning to do a national Iraqi pharmacist workforce. You heard about it. I put the link on your website. Because I needed representative sample to the Iraqi pharmacists. We have almost 18,000 maybe Iraqi pharmacists. I excluded the ones who immigrated outside the country. I asked them to participate. I put the link 2 months on the website of the Iraqi pharmacists. And I only got 650 with full answers. Imagine, we don't have good numbers to represent our professionals, our patients. We need comprehensive participation. Every study in Iraq, we usually have a couple hundred, and we say, to represent Iraqi patients. I say, you only surveyed 2 or 100 in one province. How can you generalize your finding to Iraqi participants? You need to conduct the study in more than one province, in large number of participants, before you generalize your area. Now I usually say to my student, please add the province you conduct the study in there. Because when you say an Iraqi patient, it's large there, but you only conducted this in 30 or 40 of them in Baghdad teaching hospital. You need to say in Baghdad. Don't like say it's generalizable while you have low sample size.
Sure. How did they include a large number of, like we say, pharmacists in the US for like your project? How to increase these numbers?
In the US, they usually have funded studies. What do you mean by funded? They usually have some incentive. Like the participant, usually either they receive, for example, they receive a rifle of, like they make something like lottery for the participant. I have like 10 gift cards of $25 each one. I will give 10 of them. And your name will enter the lottery, and you will, the rifle will get, you have opportunity of 10% to get one of them. So they give some incentive, or they give to some incentive so they increase the participation. we usually hear our studies, because there they have some organizations, they support the study, such as the National Institute of Health, which is the NIH, which is the federal government, or other organizations such as ABHA for pharmacists, or American College of Pharmacy Association, American Hospital Pharmacies. All these, they fund the research. In my study, we gave $250 to each nursing homes. Even it's small incentive, but still there is incentive for you. And this is one way. You increase the, you give incentive. This is a good question. How can we increase the participant? Either you give incentive or reduce barrier. What do you mean by reduce barrier? I need to make my survey short. I need to make it easy to understand. I need to make it, I don't want my participant to put efforts to answer. For example, in the US they have mail survey because they have good mailing system. They send, for example, if they need to survey elderly people, they don't send them link because the elderly people, they don't watch social media. They are old-fashioned people. They usually read the mail. So as a researcher, if I need to survey, what happened is one of my colleagues, she wanted to survey a participant in Medicare, those people above 65. She sent them a letter by mail, and she put, we call it a return label, prepaid envelope inside it. So they sent the letter. The letter has the instruction for filling the survey, has the survey paper, and they included the envelope with prepaid stamp. So the participant will not pay out of their pocket to return the letter. They only need to answer the survey, put the survey back inside the envelope, and the envelope is already prepaid. Their role is only put this envelope in the mailbox, which is available in every street or every single city. Reduce the barrier. You don't ask them to pay out of their pocket to return your envelope. You prepaid the envelope. So they only put the, this is the way they reduce the barrier. Unless, try to encourage them. Other participation, you give them incentive. Give them parking, like you say, if you need to participate, I will pay you the parking fees. The usual parking are not free. So at least pay them the parking and give them some incentive. Good question. How can we measure the health literacy? Health literacy is still, anything we need to measure, we need to have some tools. That's right? Because how can I measure something without tools? What do you mean by tools? I need to have some scales, some questions. That's why researchers try to develop with the time to collect the information from the participant. Our participant usually, we call them participant, but they are mostly either general people or patients. I like the term participant. I don't like the term patients unless it's very obvious. Because sometimes patient is not accurate term. Like not every single customer to your pharmacy is a patient. Sometimes there are healthy people who comes to pick up medication to their relative or their family member. So not every pharmacy customer is a patient. So participant, I think it's better, okay? And we can apply participant term on the even healthcare providers. Pharmacists, if you survey pharmacists, you say participant. Because the participant who participated, okay, the people who participated, who agreed to answer your questions. One of the, I only listed 4 tools or measures, but there are so many tools we can use to measure health literacy, but I only, for the lecture's sake, I only listed 4 of them. I used 3 of them in my studies. I did a couple studies, one in Iraq with Dr. Mohammed Al-Rikabi, and the second one in Saudi Arabia in collaboration with the College of Medicine. I used 3 of them, but I listed here 4. The first one is CILS, which is Single Item Literacy Screener. CILS is the simplest one. We only need to ask one question, one subjective question about the, do you need help to understand or to understand your instruction from your pharmacy or doctor? That's it. And you have 5 choices. Always, often, sometimes, never, rarely. That's it. This is simplest one. You can ask it in your pharmacy. But it's subjective. You are not going to test the participant. You ask them one question and they evaluate themselves. That's why it's subjective. The limitation is it's subjective because, especially in our culture, in Iraqi culture or in Arabic culture, we usually pretend we are better. You know, if you ask me, even my English skills is not good, I usually say it's proficient, it's good. You know, that's why it's subjective. We cannot actually evaluate the accurate health literacy level. The second one, I think it's available here. It's new vital signs. New vital signs. We have basically label of content label. For example, ice cream label. We have ice cream label. You give the ice cream label to the participant and give the participant list of questions. The ice cream label, they usually have the how many carbohydrates, how many fats, percentage. Have you heard about how many of you guys read the content before you buy food, especially the canned food? Sometimes. Never. Yeah. In the US, they usually people they have trained to read the content because they obsessed about how many calories they consume every day. They care about the content. So we usually look to the cans. We only read only the expiration date. They look to the cans. They need to read the content. How many carbohydrates? How many energy, fats, all these content, caffeine, whatever. So basically you give this content to the participant and ask them a couple of questions. For example, about the fat. If your physician say you cannot take more than 30 grams, for example, of fat per month, how many of those you can consume? Such questions. They need to read the content label, they need to understand the content, and they need to answer the questions. And there are only 60 questions about the ice cream label. If they answer all the 6 correctly, they have full mark. If they answer 4, they are intermediate. Intermediate health literacy. If they have answered only 2 of them correctly, they have limited health literacy. Okay? 6 questions about one of the food label or ice cream label. Okay? The third test is ASTOFLA, which is related to health literacy for adults. ASTOFLA has 2 components. One is reading, one is a numeracy table. What's the difference between 2? As you can see in your handout, the reading, we usually give passages. The passages we call it prose reading. What do you mean by prose? We usually have 1 missing word. Every 4 words, we have 1 missing word or blank. And we give 4 choices to fill this blank. Okay? And you need to choose the most appropriate word to fill this blank. Imagine. You have reading, and you have missing words. And I think the most famous Astofla readings talking about the preparation for X-ray. And the second one, your responsibility or preparedness for the Medicaid. We translated Astofla to Arabic, and I used the Arabic version in my study in Iraq in 2014. We published in 2015. The Arabic version, because as you know, Iraqi customers or Iraqi people, we assume they don't understand English, especially the pharmacy customer. That's why we translated to Arabic, and we interviewed or we asked the pharmacy customers. I think at that time there were two provinces, Najaf and Babylon. Good memory. So we asked the pharmacy customer to fill the Astofla. And it's more objective. Why it's more objective? What's the difference between Astofla and the cells?
The cells is subjective. Now
Exactly.
we have reading and numeracy. This was only subjective and bias the cells, because not everyone will say I need help. Here we have a question, and for the cells I mean.
Exactly.
Not everyone will say I need help. So it's bias and subjective. But Astofla, no, it has the reading skill and numeracy skill, and there's it's more complicated.
Sure, yeah, 100% accurate. As I said, we have objective test, which is Astofla. Why it's objective? Because it's test. Right? It's test. While cells, you ask the patient, do you need help? They will say sometimes, never, or rarely. And I used both tests for the same participant. And the Astofla, they have different result than the cells, because Astofla will measure the accurate one. Okay. The fourth one is rapid estimate of adult literacy in medicine. I didn't use this in my study. Why? This test is mostly to pronounce the English term of some medical conditions, such as diarrhea, osteoporosis, obesity. So it's pronunciation. I say if it's English term and you need to pronounce, I think I decide this was not appropriate choice for our participant, because they need to pronounce some English terms which is not our language. So what did I use? Single item literacy screener. How often do you ask someone, this is the question for the participant, how often do you ask someone for help to read the instruction and leaflet from a doctor or pharmacy? You will ask this and you will give 5 choices, never, rarely, sometimes, often, always. In my study, I found so many people choose sometimes. Because in Iraq, culturally, we tend to choose sometimes. We like sometimes. Because we feel it's in between, nobody will be upset, I will be in safe zone. I would say sometimes. But actually sometimes mean limited health literacy. Those are 3 answers. Sometimes, often, always mean limited health literacy, mean you have limited reading ability. Because sometimes mean you need help sometimes. While the participant with never or rarely, okay, still working. I think there's something wrong with this thing. That is a miracle, because the TV was still working. Okay, everything. Could you turn off the conditioning? Because yeah, please turn it off. This is not good. Thank you. And you watch only under this condition, otherwise. Okay. So, do you have a question about using cells? Simple question, but as I said, subjective and biased. because I evaluate myself as participant. There's no test. The second one, as I mentioned, which is new vital signs. I will come back to this later. The second one is new vital signs. I have ice cream label, how many carbohydrate or calories in each content of those, like the amount per serving, 250 calories, total fat, 20%, 13 gram. And I have questions such as, if you eat the entire container, how many calories will you eat? The entire container, how many calories? The container has serving per container, four serving. Each serving 250. 4, it's 1,000. This is the most difficult questions. This is the most difficult tool. I use it. And the participant, they did very bad job at this test because it's really hard. It's really hard test. And they have limited time. It's not open time. And I was there at the International Conference of Pharmacy Workshop in Boston in 2014. And we had visiting researcher from Spain. And I was talking with him because he also used this before me in Spain, but he was translated to Spanish. He only used this one. And I was complaining about Iraqi participants, they didn't do well in this test. He said, even in Spain, they didn't do well. So it's really hard test. NVS is a really hard one. So in my study, in this one, as you can see, this is the results of NVS. These are the results of Law. For the Law, 77% of participants, they have adequate health literacy. While for the NVS, only third of them, here it's 2/3 of participants, they have good, adequate health literacy. Here only 1/3 according to NVS. This is the summary of this table. And this test, NVS, new vital signs about the label, only third of the participants, they had adequate health literacy. Imagine, it's opposite results. They did very well job in the Law, and they didn't do well in the NVS. The same participant. That means it's harder test. The other test is Law. In Law, as I mentioned, we have two different tests. We have reading, we have numeric. The reading, we have this prose passages, we have the sentence, we have missing word. Your doctor has sent you to have a blank X-ray. Stomach, diabetes, stitches, germs. You need to choose one of them, okay? You must have a stomach when you come for and it's obvious, empty, you know, but this is objective terms. You need to choose one of those, put it in the plan, okay? Good examples. The second part of the same test, we call it numeracy test. Numeracy, it's related to the numbers. What do you mean by numbers? You need to give the participant, for example, the appointment sheet and tell them your appointment will be on Thursday, April 2nd, 10:20 a.m., location 3rd floor. After they read it, you need to hear from them verbally if they understand this. Other questions, they say if the normal range of sugar less than 120 milligram per deciliter and your blood glucose is 140, is it normal or not? This is the second one. So those numbers, you need to understand the numbers and the timing. That's why we call it numeracy. And we usually have 30% related to numeracy, 70% related to passages. So in summary, we have row, which is, we have the, when I said revise means shorter. This one is long one, 66 medical terms. they make it short here, only 8. Because they have no time, they try to reduce the time. So TOEFL is the long version. TOEFL is short term, short version. When I say S, means short version. So the original one, 22 minutes to complete, while the short term needs only 12 minutes to be completed. Imagine, it's shorter, okay? We try to make it shorter because we know the patients or participants, they have no time. We try to make the test shorter with the time, okay? English, all those are available in English and Spanish. But in my study, I translated NBS, TOEFL, and CELS to Arabic as well. And I got several requests from other Arabic, because I was the first one translated to Arabic. I used it in Arabic culture. And the first one used 3 tests together. I got so many requests from other Arabic researchers. They asked me to use my Arabic version of the health literacy instruments. And I sent it to them for free to use it. So the idea here, it's really important. We need to assess the health literacy of our patient, of our participant. Because why do you think it's important to assess the health literacy of our patient? Why it's important? Why do we need to use these tools with our patients?
Improve it.
We need to improve what?
Improve health literacy of the patient.
If we cannot improve it, we need at least, for example, if I ask this patient a couple of questions and I found this patient to educate them, I will spend longer time because I know Abbas has limited health literacy. So I will spend 5 minutes with Abbas, while if I know Kadhim has good health literacy, I will spend only 2 minutes with Kadhim, while Abbas needs more, needs 5, needs 10 minutes. So I need to spend more time, more efforts. I may send pictures, I may send CD of instructions or video, or I try to. So I need to find a way to increase the health literacy. And some of the way they send videos, audios, pictures, try to educate their healthcare giver if they have younger folks with them. So it's important to assess especially for the long-term patient, especially for patients with chronic disease, because those are loyal customers. Okay, you need to make sure you need to know their level of health literacy before you start. You cannot imagine you know everything about diabetes. Okay. That's why it's not appropriate for pharmacists to use technical terms. Don't use technical terms or English terms. Try to, when you talk with the patient, try to avoid all the technical terms. مو تقول له هاي الأوبرا لازم SC يضربوا فيها مو IM. وش معنى بالSC؟ يعني يعرف الIM، يعرف الIV. يقول له هاي تحت الجلد وهاي بالعضلة وهاي بالبيت. اي يعني فهم اياها بالعربي يعني. ابدا تستخدم technical terms. So this what I found in my study. My participants, they did very well in TOEFL, they did not well at the NBS. The last test is real. You need to pronounce those terms: menopause, antibiotic, exercise, jaundice, rectal anemia, behavior. Those are just samples. If they pronounce well, they put check, 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 check. Here. So as I mentioned in the last lecture, we conducted this study in Iraq, 2 provinces, Najaf and Babylon provinces. Before I published or sent my article to publication, because you are graduate students, you need to know what step will improve your publication. You need, These manuscripts, as I mentioned in the last hour, I participated in 2 or 3 conferences. In every conference, my advisor, after I returned back from the conference, my advisor, what's the question he was asking me? He said, how many researchers stopped at your poster? Did you get many people ask you questions? Because he cared about the feedback I get. He cared about the feedback because he knows the feedback is very important to improve the quality of the article and the manuscripts. So if you have an idea of project, discuss this idea with your colleagues, try to participate. Don't afraid to participate in public presentation. Your colleague last semester, the other master students, we had 9 master students in last semester in the clinical pharmacy department here, and I forced them to do public presentation. What do you mean public presentation? I asked them to go to the Azeez auditorium, and I asked them to present. I did the invitation, public invitation, nobody came there, but it's just public invitations. And I asked everyone, if you can come, welcome. So I need you to have the ability and the courage to present in public. Because most of you are academics, or even those are not academic, you will be academic at some point. You may present at the international conference or national conference or local conference. You need to have good confidence. You need to have good presentation skills. So try to present. With the presentations, you will get feedback. Don't say, if you get feedback, I'm talking about constructive feedback. Don't say, okay, هذا دي عقل براسي ديسني هواي أسئلة. No, don't take this bad an idea about the feedback. Usually feedback will be helpful. I need to address the weakness, the limitation in my study. I need to improve my study. I need to improve my presentation skills. That's why here in this course, I try to give you these presentations every other week. Because at the end of this semester, I need you to practice presentations. I need you to overcome the fear inside you about the presentation. Now I can say half of you, more than half of you doing very good at the presentations. More than half of you are excellent presenters. The other ones, you are improving with the time. If you don't practice, you will not improve. Don't say, you put me in, okay, difficult situation, you try. We are in learning area here. We are trying to improve our skills. It's okay to make mistake here, because this is the class. This is the right place to do mistake. Because I need you, when you go to the conference outside the college or at any meeting, local or national, I need you to remember the feedback I gave to you in every lectures. All the feedback about using your gesture. Don't block the screen. I just blocked the screen. And don't use very like tiny text in this case. Very tiny. This is bad example. This is just for you as as material. Don't use tiny text. Don't try to hide your hands. Don't try to move around. Don't try to use the fast pace. Try to be calm. Try to look at your audience. Look at their eyes. Try to engage them. Use your gestures. Use visual aids. Use pictures. Pictures usually, they are attractive to people. Attractive. People, they care about pictures. You may care about the picture more than the table, I know, because it's really attractive. They have colors, they have picture. So we need to improve our skills. With the time, I think you are doing a very good job, all of you. Try to work on your presentation. Do you have any question about health literacy? Health literacy is simply different than the regular literacy. We need to assess health literacy. We need to know if our participant Maybe I can add some tips for you if you need, because Hani reminded me about one thing. How can we improve health literacy? We can improve it either we use, for example, if you know these patients, you can give them leaflet. In the US, they give some instructions, extra instructions. They put it in the back with the medication. We can give instructions. We can give visual aid, like those stickers. We can give CDs about videos. For example, if you need to teach your diabetic patient about proper using of insulin, you will give them video, either link of the video or the CD, say please watch this way at home. They will go and they watch the appropriate way to give the insulin. This way will increase the health literacy. We need to give them educational, we give them pictures. All these are tips to increase the health literacy. Okay? Any question about health literacy?
This may not be very relevant to this test, but sometimes when a patient reads the leaflet, he or she ends up not taking the medication because he says like there are some very dangerous side effects. They don't realize that not all of these side effects are going to happen. So.
Yeah, I understand what are you saying. Because we have some people, they are obsessive. If they read the leaflet, they may end up stop taking the medications because they think even the rare ones, the important. We got all those customers at the pharmacies. They usually bring the leaflet back and say, you are giving me this medication with all those side effects, or what are you doing with me? What did I do for you, or something like that. We try to explain for them, those are rare, those will not happen for all people. And if we can give something, not with details as I mentioned, something like how can you use insulin? I think Dr. Dia has good manual in Arabic for diabetic patients. Imagine, he wrote a manual in Arabic for diabetic patients in Arabic. What should they do? How can they take the insulin when they take it? How can they, what should they do if they feel hypoglycemia symptom, side effects? So you give them some instructions without all these details. If you need to teach them about insulin, give them the steps of taking the insulin injections by pictures and give it to them. And imagine in the US, every pharmacy I know, they have the leaflets in 2 languages. The first language in English, the second one is Spanish, because they have growing minority of Spanish-speaking populations. Now it's maybe 20%, I'm not sure about that. 20% of Latino people, Latinos live in the United States. Their primary language is Spanish. So most pharmacies, they have the leaflets in both. If you go everywhere, and the bus or other stations, you will find English and the Spanish. This is because if this patient cannot read and cannot read this English, you give them the Spanish one. I did one of public health research before because I got the master in public health from University of Iowa. My study was about health literacy and barriers of Arabic speaking populations in Iowa City and Johnson County. And because it was public health project. In public health project, in public health project, you need to find the problem, you need to study the problem and find the recommendations. I took the recommendations and I presented my findings in Johnson County public health meeting. I remember this. Even after the course, I was graduated at that time. I was graduated from the university because the course was done in December. The last presentation at the December 5th, imagine. I'm done with the course in December 5th. I presented in December 13th because I felt responsible. I need to present my data to the beneficiaries, the people who will benefit from my study. I went to the Johnson County meeting, and I presented my finding. To whom? To the board of Johnson County. I tried to give the recommendation according to my findings. One of my recommendations was we need the leaflets for the medications in Arabic as well, because Arabic is a growing minority in Johnson County. They deserve to be recognized in the leaflets or the pamphlets. One of my recommendations, remind me about the language, is to give Arabic written material to the participant. And I suggested this for the next public health student. He can study or she can study or can make Arabic written material for the Arabic patients in the city. In this way, we will increase the health literacy of our participants. Do you have more questions about the topic?
I have an addition. In my pharmacy, I stimulate the patient by the use of inhaler. I open the inhaler, I stimulate how to use it in front of the patient, not just by the picture. So he could get the big picture here. And asked him to go to YouTube and see videos before he used the inhaler. I see the results were excellent. From the first use, he learned how to use it.
I think it's very good practice, what just Hani said, because we have so many people, they don't know how to use the inhaler correctly. And if they don't use it correctly, it will not work and they will not give a good effect and will end up with admission to emergency room. Especially people with asthma, we have so many pollution and our environment is really bad weather outside there. We have all this dust. So we need to use the inhaler appropriately. I think Hani doing a very good job about try to increase the health literacy. This is one of the health literacy. How to use your inhaler. It's the health related issue. It's not general health literacy, it's health literacy. I think we can all use it in our pharmacy. Thank you so much for sharing your experience. Do you have any more additional comments? Thank you so much. Turn it off.